session and of the scrolls, and we will look forward to seeing you. Thank you very much, and once again, a warm welcome to all of you. Thank you.
Thank you, sir, for your words of motivation and warm welcome. And now, next on the agenda, as you all know, the India HPSR Fellowship Program is anchored at HSTP. And to give a brief overview of HSTP, I would like to call upon Dr. Rahul Reddy, the National Coordinator of the event. Dr. Rahul is a health systems and financing specialist driving strategic planning, supporting design and management of capacity building and policy dialogue initiatives, donor relations, and collaborations at HSTP. Rahul, please.
Thank you, everyone. This is a privileged moment for me because I've been associated with HSTP. What I'm going to present today is several others who were the building blocks of HSTP. And our flagship program for and as Raja mentioned, came into so that we bridge the knowledge gap that Indian health system, where we generate on systems and policy that could be used by policymakers, and also provide an opportunity for researchers to interact with the policy community and present their ideas so that we have evidence-based policies in the country. We do this, as you know, in collaboration with the expertise that is available to us in India and abroad. As you see, the construct of every program that HSTP does believe in this ethos that there are existing experts at the local level, starting from the district, to the national level, and also globally, who could collaborate on solving problems for making India where we want to see it in 5 years or 10 years from now. So, what we currently plan to do in the first 4 years of the business, that is until 2024, is largely based on 8 programs. That is Odisha Health System Strengthening Program, where we have completed a diagnostic assessment of the Odisha health system, and we are doing 2 interventions in consultation with the government. After we have understood the feasibility and socio-economic and the local context that the government and the other stakeholders in the state are working in, we are working towards strengthening their primary healthcare professionals' competencies, and then strengthening their business and access to medicines, which is a program that delivers free drugs to people through public facilities in Odisha. Then we have strengthening primary care in urban settings, where we are working in Mysuru and Indore, where we are trying to bring in a WHO framework for healthy cities in India, and we are also trying to strengthen the referral linkages and the connect to UPHCs in urban Mysore. As Rajiv already mentioned, 2 of our flagship capacity programs, one is flagship on health systems and financing, and the India HPSR Fellowship Program. Then we have a team of researchers who are working on health regulations in India. You might have seen a scoping study that has been completed over the last year, and they have been disseminating it through several public fora, getting people together to talk about the regulation space in India and trying to move towards a better system. And then our work along with health action by people on decentralization in health sector is just completed. As we are a federal state, this is an important piece of work in governance that we would be disseminating this year. And we look forward to a lot of learnings for other states, especially in the view of the Finance Commission. On the policies and implementation programs. In the last 4 years, we have a report on primary healthcare in India, which illustrates the best practices and innovations in primary healthcare. 17 of our cohort fellows, 2021, have completed their research, and we have almost trained 150 for senior policymakers through the Untitled program. Yeah. And in doing all this, we would like to thank who have worked with us from the states and from interact with them on a frequent basis, and you will also have a chance to interact with them during your fellowship. Thank you so much for embracing us with this opportunity, and I think as we go, we would like to grow all along with you and along with all our partners who have been most supportive. Thank you very much. Have an enjoyable fellowship for the next 18 months.
Thank you, Rahul, for providing the overview. And now, next on the program, I would like to request our chair of the Academic Committee of the India HPSR Fellowship Program, Dr. N. Devadasan, for his address and overview of the fellowship program. Dr. Devadasan has worked for over 3 decades as a public health professional, starting his career as a community health officer in building a comprehensive health system over there. And since then, he has worked with various organizations, WHO, HSTP also, and he has headed many multiple research projects, including 2 large multi-country projects. So please.
Thank you, Shilpa, for the kind introduction. Dr. Vinod Paul, Rajiv Saran, and Dr. Rajesh Kumar, my friends from HSTP, and all the young researchers who are going to be with us maybe for the next 1.5 years. A warm welcome. So this thing is just to give you an idea about what is HPSR. Just a very small glimpse, and I'm sure all of you all will pick it up along the way. But before I go there, I would like to thank Rajiv Saran for his leadership in ensuring that this program continues. There were a lot of issues for the first cohort, but thanks to his leadership, and especially the second cohort, he stuck to it and said, no, we are going to have it. And I would like to thank him for continuing this. And I hope I'm sure we'll have many more cohorts in the coming years. So, why do we need we talk of epidemiological research, we talk of economic research, we talk of social science research. So why do we need a health policy and systems research separately? Because if you look at the literature, you go to PubMed or you go to Google Scholar or whatever, Scopus, etc., most of the questions that are asked by a traditional researcher is the what question. What is happening? What is happening in COVID, or what is happening in maternal mortality, or what is happening in NCD? Now, for the policymaker, they may not have that evidence. They may not know this. The prevalence is 20.22 or something like that. But they know, yes, NCD diabetes, there is a high prevalence in India. We are a diabetic capital. They are more interested in the why question. Why is it happening? And how can I solve it? And that is where HPSR comes in, because it brings in various disciplines to ask this, to answer this why question and how question. So these are the aims and objectives which we started off with. Basically, it is to build a capacity of Indian researchers. I'm not saying that there are no Indian researchers, but we want to build a critical mass of Indian researchers who will do research in India on health systems, generate the evidence to influence policy. And the idea is also to build a community of practice so that this body, this alumni of health system researchers meet together, learn from each other's peer learnings, and sustain the movement over the years. So a very brief overview of this program is today we are having the face-to-face, which will be for 4 or 5 days. Then we have a 6-month online phase where we expect you to log in onto the LMS, the learning management system, and listen to the videos, etc. And I'm sure now, thanks to COVID, all of us are familiar with these sort of learning systems. We would have done many courses in Coursera, etc. So that is one this thing. And this online phase will be tutor guided. There will be a person who will be supporting you, interacting with you all, and including the faculty. And then there's a next face-to-face session where you all will come with a proposal, which will be then presented to an international jury, who, based on your presentations, the merits of your presentations, will say, okay, this proposal is good enough to go. And then those people are given the initial grant to start actually implementing the research proposal, which is something which is very unique to this course, because usually most courses stop at a proposal, but we say you take it to the next level of actually implementing the course. And then, of course, at the end of 1.5 years, and I'm sure most of you all will do it, succeed, you'll get the certification. Yeah, so this has been the evolution. We started off with in 2020 with a very good consultative meeting with experts from all over the world, from the US, from UK, from Australia, as well as South Africa, a lot of from Belgium, etc. And then we've just moved on, and today we are here for the second cohort. We are starting. I'm very happy to see this second cohort here. This was the first cohort. As you can see, the wave was mostly in South India with a little few smattering from East and North. But today, I'm glad to say we are moving more and more north, and there are more representatives from North and also from the Northeast. And I'm looking forward to a rich discussion from all of you all, learning from you all of what is happening in all these states, etc. So these are our faculty from Belgium, from India, from these are our faculty. These are our faculty. You'll meet some of them. Dorothy's on the way. You met Sumit, Devaki is here, and then Prashant and Rakhal will join us online. Unfortunately, Bruno and Sarah, because of their own personal commitments, they won't be able to come this thing. But other than this core faculty, there are many others who have contributed to this course, both in terms of development of the material, in terms of reviewing your applications, in terms of mentoring you all in the future. So there's a huge number of people involved in this course, and I would like to thank all of them for making this a reality. And once again, welcome to this course, and thank you for being here.
Thank you, Dr. Devadasan, for taking us through this journey. The faculty has already been introduced, and I would request, we have today joining us 17 fellows who are present here for the face-to-face session, and we have 3 fellows joining us virtually. If I may request the fellows to just kindly introduce yourselves with your name, your designation, your affiliated institution, for the sake of Dr. Paul. May we please have a round of introductions from the first table. There are mics placed at your tables, so I would request you to please introduce yourselves.
Variants हो जाएगा. Variants हो जाएगा. After introduction.
You can switch on the button at the, yeah.
Otherwise, also your audio. No. My.
Dr. Kalesi Singh. I'm coming from AIMS Nagpur. I work as an assistant professor in the Department of Computer.
On करना जरूरी इसलिए है ना.
Good morning. I'm Divya. So I'm coming from Kerala. I work with an NGO called Health Action by People, working with decentralized governance and health sector in Kerala.
Hello everyone. Good morning. I'm Shweta Marathe. I work with the NGO called SASA, which is based in Mysore. Thank you.
Morning, everyone. I am Dr. Giridhar Gopal. I'm right now associated with Centers for Disease Dynamics, Economics and Policy. Previously, I was an alumni from AIMS Delhi. Thank you.
Good morning, everyone. I am Dr. Jacob Islari. I am associated with Assam Don Bosco University, Cohort.
Good morning, everyone. Myself, Dr. Sunil Kumar Panigdahi. I am an assistant professor working in Dr. Vasantrao Par Medical College in Nashik. I'm based in Nashik.
Good morning, everyone. I am Yashwant. I work as a senior scientist at Indian Institute of Public Health, Gandhinagar. Also a postdoctoral fellow at University of Bonn, Germany. I work on One Health and zoonosis. Thank you.
Good morning. I am Dr. Mitasha Singh, currently working as assistant professor in Department of Community Medicine at ESIC Medical College, Faridabad.
Well, good morning, everyone. I'm Dr. Nafis. I work as a faculty cum epidemiologist at Jawaharlal Nehru Medical College, Aligarh Muslim University, AMU.
Hello, everybody. I'm Pritam Mahajan. I work as assistant professor in community medicine at JIPMER in its new campus at Karaikal. Thank you.
Good morning. I am Prasanna. I work as associate professor community medicine in AIMS Jodhpur.
Good morning. My name is Bhavan Vinay Kumar and PhD in public health. And currently I'm a consultant with Institute of Economic Growth, Delhi.
Very good morning. My name is Pankaj Tiwari and I am a family physician by training and I belong to Jan Swasthya Sahayog Chhattisgarh and I am working clinical side as well as on health system part of our organization. Thank you.
Good morning. My name is Dr. Radha Valadikar. I'm originally from Goa. Started out by working as state epidemiologist for NCDs for the state of Goa. Thereafter, I went on to lead the NCD TSU for Maharashtra through Piramal Swasthya's partnership with Government of Maharashtra. And currently, I am heading a World Diabetes Foundation funded project in the state of Assam for Piramal Swasthya. I'm a doctor with MD in community medicine. My area of interest is non-communicable disease. Nice to meet you all.
Hi, I'm Kuhika. I am working as manager health systems research with International AIDS Vaccine Initiative. Prior to that, I was with the International Center for Research on Women. I largely work on issues of sexual and reproductive health, primarily family planning, HIV, STIs. I'm very keen to bring in a gender lens of gender equity and equitability into all our work of sexual and reproductive health. Thanks.
Good morning, everybody. I'm Dr. Megashield Sharma. I'm from an organization called Jipaigo. I serve the comprehensive primary healthcare services through the Ayushman Bharat Health and Wellness Centers. And I had a chance to look at the last year's report. So which said that the fellows have to learn and unlearn. So I'm also ready to unlearn and, great to meet everybody. Thank you so much.
Thank you, everybody.
We have three fellows joining us online. If I may request them to introduce themselves, please. And if you could switch on your cameras. May we begin with Dr. Trusty, if you can hear us.
Hello, everybody. I'm Dr. Trusty, and I have passed out from, I did my MD Community Medicine from PGI Chandigarh. And after that, I have been working as a public health specialist in health services Manipur. And I'm happy that, and I'm really, enthusiastic to be a fellow. And I hope I can learn a lot and give some of my services through this fellowship research program. Thank you.
Thank you, Dr. Trusty. May we have Manjula next, please?
Hello, good morning, everyone. Thank you so much for having me. And kindly excuse my online presence. I am Manjula Bahuguna. I completed my master's in public health from Tata Institute of Social Sciences. And I'm currently working as a consultant research for an NGO based in Mumbai, SNEHA, the Society for Nutrition, Education and Health Action. Thank you so much.
Thank you, Manjula. Do we have Dr. Yuvraj?
Morning, everyone. So I'm Dr. Yuvraj. I am currently working as assistant professor in ESIC Medical College, Chennai. I'm sorry for my online presence because of my prior commitments, but I'm excited to learn more in this fellowship program.
Thank you so much. Moving on to the next agenda, we would now like to play a message from Dr. Abdul Ghaffar, the Executive Director at the Alliance World Health Organization, who will be addressing the incoming cohort 2022. A physician by training, Dr. Ghaffar has worked in low and middle income countries over the past 30 years. He's been managing a wide range of research portfolios, designing and evaluating national health systems, and training future generations of health systems researchers and decision makers. Dr. Ghaffar helps to shape the HPSR portfolio through developing and testing innovative models in both research and implementation of programs for health system strengthening and enhancing the use of evidence in decision making. May we have Dr. Ghafar's video, please?
Greetings from the Alliance for Health Policy and System Research, World Health Organization headquarters in Geneva, Switzerland. It is a pleasure to be here with you all today. Let me start by thanking Shri Rajiv Sadanathan and the Health System Transformation Platform for the invitation to address you all today. And to the new cohort of the India Health Policy and System Research Fellowship, let me join in offering my congratulations. You are part of a growing group of researchers, policymakers, and health practitioners, not just in India, but around the world, who have come to recognize the critical importance of health policy and system research, or HPSR, as I like to call it. And there has been no greater testament to its importance than the ongoing COVID-19 pandemic. Many have noted over the last several years that no one is protected from the virus until everyone is. And to do that, broad coordination across governments and the private sector is required, a so-called whole of government and whole of society approach. This sort of approach does not work in silos. It needs to be underpinned by transdisciplinary research like the field of health policy and system research that borrows from economics, sociology, anthropology, political science, public health, and epidemiology to form a comprehensive picture of how health systems are performing and adapting to change. Historically, there has been an overemphasis on biomedical research. Indeed, a recent study found that less than 2% of global health funding goes towards HPSR. While biomedical research is critical, it has long been recognized that it's not sufficient to create health and well-being for all. In, for example, the vaccine that were developed and tested at that time in response to COVID-19. Still, today, 1/3 of the global population has yet to receive a single dose. In low-income countries, the difference is even more apparent. Percent have not received a single dose. Partly, this is a question of who pays for the vaccine, but there are also questions of distribution, the availability of a trained health workforce to administer the vaccine, the existence of information systems to help keep track of who has and who hasn't been vaccinated, and the leaders who are willing and able to take the tough decisions needed to adapt health systems in response to the pandemic while maintaining other essential health services. These are the building blocks of health system, but HPSR has always stressed the central role of people in this system. For example, social factors inform human behavior, like whether someone decides to get a vaccine or not. And then there are other challenges like conflict or hunger that are more immediate and demanding than taking a pandemic for too many around the globe. Equity has been one of the core principles of the Alliance since it was first established 25 years ago. And perhaps this example begins to explain why this focus is so key both globally and within countries. Ensuring there's local funding for and local capacity to undertake research, but more specifically, policy-relevant research done in collaboration with decision makers is a critical part of tackling these global inequities. It is one of the reasons that the Alliance has been such a keen supporter of this fellowship and other initiatives like it around the world. This fellowship is a special opportunity to learn the many skills needed to be successful in HPSR. Treat it not just as a chance to learn the necessary scientific skills, but also think of it as a chance to grow your networks and to develop your networking skills. Creating linkages among your peers and with decision makers is central to HPSR. It is also a chance to learn about how to engage with policymakers and to understand and analyze policies and their impact on health systems. It has been said that policy is built like a sausages. It is better not to see them being made, but HPSR reject this. The P in HPSR is there for a reason. Policies are not one size fits all, and policy-making processes are really linear. Their success depends on how they are framed and developed within their national or subnational political, economic, and social contexts. It can require real leadership skills to navigate and persist in these complex environments. And that is another skill I hope you will start to develop here, since you are the HPSR leaders of tomorrow. As you begin to learn more about HPSR, you may also begin to learn more about the Alliance. We promote the generation and use of health policy and system research as a means to strengthen the health systems of low and middle income countries. We do this through advancing the field. We do this by supporting embedded research projects. And we do this by investing in the capacity of researchers, policymakers, and others to generate, synthesize, and use evidence. We offer cutting-edge resources like our series of flagship reports. Our flagship report on system thinking from 2009 is one of the cornerstones of HPSR. And our most recent flagship on fostering learning health system puts local research, data, and analytics at the heart of health system strengthening. We also offer readers and guides that you will no doubt become more familiar with during this fellowship. To keep up to date with the latest developments in HPSR, I also encourage you to join the Alliance Hive, an online community of practice that brings together experts in the field to share resources and discuss ideas. We are also excited to launch a new online learning platform in the coming months that may be of particular interest to you as you continue on your HPSR journey. I wish you all the best during your fellowship But more importantly, I hope that you take to heart your role as ambassadors and advocates for FPSR. The field has the power to inform and shape some of the most pressing problems the world is facing, but only with your help and dedication. Thank you.
We thank Dr. Ghaffar for his constant guidance and support in all our endeavors and for sharing this inspiring message. And now may I request Honorable Member Health Niti Aayog, Dr. Vinod Paul, for his inaugural address. I need not introduce Dr. Paul, but he's a globally recognized medical scientist. Thank you.
Good morning. Respected Sri Rajiv Sadanandanji, esteemed Dr. Rajesh Kumarji, a very distinguished and long-standing academic conspirator. Dr. Abdul Ghaffar is not here, but I extend my greetings to him. Dr. Devdas Sanji, Sumit, Devki, Rahul, distinguished and selected because of your merit, distinguished members of the cohort of the fellowship program. Very warm greetings and my apologies for a little delay on my part in the morning. First and foremost, I like to pay my very humble and heartfelt tribute to Dr. Bhan, who has been the friend, philosopher, guide to so many of us, and particularly in my life, and whose vision is what we are seeing being rolled out by very wonderful leadership. Rajiv Sadanandanji and all the colleagues who are part of the STP family. You know, in our conversations, particularly in the course of our work in Himachal, Rajesh, you remember, this idea would come up that there is a gap. We know the interventions, experience with intervention, we got the MDGs right, but then something was missing to take India and low and middle income countries towards strong health systems. Because every country is unique. The health systems of a generic type cannot apply everywhere. And therefore, there was a need to find pathways to build a health system in our nation at the district level, sub-district level, state, national level, which has strong foundations and a very strong scientific underpinning. This was very fuzzy in our conversation. How to do it? Is it needed? And then, you know, it is badly needed when you explore further and then say how to go about it, how to make a change, how to involve the stakeholders. So these were the thoughts with which the idea came that an institution is necessary to be a catalyst of change in this important mission. And then eventually, with multiple iterations, HSTP came into existence, and you have a great leader in public health, Rajiv Sadanandanji, who has transformed the health system in one of our very important states as the leader to lead it. And thank you for translating his dream of my friend, philosopher, guide, teacher into a reality. Thank you, sir. Thank you indeed. Couple of quick points before I go to more substantive part, or boring but more substantive part. Firstly, very warm welcome. You belong to the fellows. You belong to various walks of profile of India's healthcare paradigm, healthcare system, healthcare ecosystem. I'm very pleased to see a lot of individuals, academics from community medicine background. And here is my first suggestion. Please expand this to other disciplines. First, because every discipline has a public health dimension. And today, when we are moving to an India strong health system for a strong India, a strong health system for a strong India, then the people's aspiration is multifaceted. We want to get treated for cancer. More importantly, we want to get detected for earliest possible stage of cancer. So that's oncology. It might look very, very tertiary care, but it is so fundamentally primary health care embedded. No more do we talk about cardiovascular disease as a hospital system disease. We don't. We already know that. But by the way, that journey took at least 3 decades to make it happen. Today, it's mainstream, the NCDs. There's a dimension of palliation, mental health, care of the elderly, early childhood development, and multiple facets of nutrition. So the point that I'm making is that, and yes, two days ago, I had a meeting with bringing in kidney disease into the national program for prevention. So no specialty, no clinical specialty can be there without a public intervention. And therefore, one plea is try to stimulate the imagination of clinicians as well. And here, of course, pediatric children, child doctors have had a good innings in the wake of diarrheal disease, pneumonia, newborn health, and so on. And I think you can see that that made a difference. So I would urge that we also ignite the imagination of other disciplines. So it'll be a great mix here. In fact, having a few clinicians here just has to have a few individuals with finance background and gender background and so on will be very, very useful. My second observation is, let me use a term and some of you will appreciate this. This looks like the incline moment to me. The reason is, and there is, you know, I can then sense a future of this mission and this movement. In late 80s, a global opinion emerged that clinicians need to be trained in research methodology using epidemiology principles. I hope I'm articulating it well. Okay, correct me. It may not be so accurate. You may know it better. So the idea simply was that the clinicians should be able to do good research which uses the principles of classical epidemiology and uses those methods and research study paradigms, so to say, to address aspects that relate to clinical treatment in a narrow sense. Eventually, it became all-encompassing in some sense. So the idea was that clinicians should be familiar with clinical trials, of course, but also observational studies, cohort studies, case control studies, economic evaluation, social science research. So this whole thought process, which I believe originated elsewhere, was then brought to India through collaboration with Rockefeller Foundation, USAID. And fellowships were created for training in universities in developed nations. And opportunities were provided to 5 institutions, I believe. And from each institution, 5 to 6 to 7 people went for training. So they got trained, the lingo changed, because suddenly, case control means a retrospective study and not a, study that you do today, sort of thing. So, and it helped. What they did was they established clinical epidemiology units and in their own institutions and conducted a lot of training, huge training, short courses, medium-sized courses. It could have been 20x more, but they did their job. And some of us are beneficiaries of that. I could not go for a fellowship in this, which I got selected for some reason, but academic reason. But I attended a course for 2 weeks, and that changed my my, I would say, research abilities phenomenally. I use that knowledge for my PhD in particular, but also other studies and also in multiple ways downstream. And I think it has helped me to move my journey in the space that God gave me to move on. So that 2 weeks training, sir, made all the difference. This happened in that Nehru Yuva Kendra. Ms. Murthy, you should know, and Dr. Nath and others. So it was life-changing because you understood the foundation and the grammar of research. And then, of course, we taught. We taught at AIMS in my own way, neonatology sphere and so on. So it has been a movement. And therefore, truly my reflection is, and that's my sticker, that it is incline movement, sir. Incline moment for research in the health systems, health policy and systems space. Therefore, what you are doing today, I hope and I believe will have a multiplying effect. It will change the quality of research in the country. Just add it change the research output, the quality of research that happened through those who made use of those training opportunities, even secondary and tertiary opportunities that emanated from that moment. So I congratulate you for starting this tough process, and thanks to your vision. We have the second cohort, very able people in the room. Now, I would also like you to notice, Dr. Ghaffar presented a book called Systems Thinking. It's a must reading book. It's very easy to read. And it tells us how moving from the MDGs era to the SDG, this is so essential for us to embrace. Because MDGs could be achieved because there was a package of priority diseases or illnesses or conditions by strengthening the health system around that. But then when we are moving forward, the SDGs cannot be achieved unless you have a strong health system all across. You can, if you try to go deep into it. And forget that. The nation has to move to a comprehensive, strong health system. We cannot be choosing one or the other. Our comprehensive primary healthcare paradigm, for example, has 12 packages, 12 domains. And you tell me what is left out of that? Nothing. It has everything, except that we are moving stepwise. So the aspiration of the people today, aspiration of the nation today, is to have a strong health system all across, 360 degrees. And Ayushman Bharat PMJ is no more about selected diseases. It's everything. It's everything. Okay? It is tertiary, it is sophisticated surgical conditions, sure, but it also has pneumonia of children. It also has pneumonia of the adult. It also has fracture if a person falls, old age and otherwise. And therefore, we are in a phase where now we are talking about access to comprehensive health care in all its dimensions. Sure, the focus has to be primary care because that is best buck for the money. It's close to the people. It's equity driven. Sure, that's why national health policy states 64%, 5% of the expenditure must happen in primary health care. But remember, that has to be comprehensive by itself. And we still have a long way to go in strengthening primary health care. And now we have more than 1 lakh health and wellness centers functional. It will become 150,000 very near future. But then we have to build all aspects of care that encompass comprehensive primary health care. And then we have commitment for secondary health as well as for tertiary health. So the point that I'm making is that moving forward, the future of India's health system is a comprehensive 360-degree strong, resilient, and health system which is supported by very competent human resources. Therefore, systems level thinking, therefore systems level training is very, very critical. And that is where then we come into the work that you are now a part of. Indeed, the evidence as to how and who to deliver healthcare has been weak. And that is the correction that we expect researchers like yourself will do. I'll give you an example in one part. When diarrheal disease program was crafted based on ORS and later zinc, studies were done in the community, and for even newborn, studies were done in the community to demonstrate outcomes in terms of reduction in mortality, nothing else, nothing less. Today, we sit down and think about how to put chronic liver disease on primary healthcare map, and the best we can do is to sit around the table. And when we can even create a package, if the country wants it to be implemented tomorrow. It's possible. The government is keen to do these things, adding on to the program. But then the actual experience, what it does, what it doesn't do, and what it takes to implement a program has to now done simultaneously rather than in series. This is a gap in the NCD space. Actually, there is a very significant gap of evidence on the ground. The need, some models are there, as I said, for CVD. Yes, indeed, for cancer to an extent. But when we are looking at other aspects, we need more evidence. But this is just one example. There's so much more to it that we can talk about. You will be taught that health system has building blocks such as stewardship and policy, you know it, financing, infrastructure, human resources, service delivery, information systems, monitoring and evaluation, and community participation. Must consider community participation and behavior change as an integral part of the health system's functions. The implementation research, as I understand, is when the intervention is ready, the package is ready, the vaccine is ready, and then you're doing research to find out how I can increase the coverage to saturation level, how I can ensure highest possible quality, how I can ensure equity, and how can I do it more efficiently in terms of managerial function. That's what I believe is my understanding of implementation research, which will be one of the dimensions that you would be looking at. One of the aspects that concern us from time to time is that we have an ongoing program, and we want to now improve that program by learning how it has performed so far in the health system's dimension, because we believe that intervention is valid, but how far have we been able to take it in terms of the change that we want? Now, a simple way to look at that would be a survey or an M&E, but there is a more deeper way to assess that. Does it change outcomes? Does it change behaviors? So let's say the current program of screening individuals for diabetes is fine. We have a provision for giving anti-diabetic and other advice, but does it lead to control of diabetes at population level? Does it change the overall prevalence of uncontrolled diabetes in the population? That requires a different paradigm. So I would like to distinguish a routine monitoring evaluation, okay, how the system is working, HMIS and otherwise, to a deeper way of looking at the existing programs and then advising improved versions of those programs. Anemia is a program. We refined it just about 3-4 years ago, I think, 2017, I guess. Anemia Mukt Bharat program and guidelines were created not too far back. And we want to be sure whether the elements in that, if there are some unique elements such as test and treat, are they optimally implemented? What are the barriers to this? Is it the hemoglobinometer? Is it the training? Is it the uptake by the community? So kindly keep this in mind, that this is an aspect that the policymakers need. This is an evidence to improve policy and program. So I'll give you a couple of examples, but I would compliment you for your commitment to take forward the knowledge in the area of health systems and health policy, And indeed, yes, we need to create a much stronger and a more expansive cohort of researchers in this area across this great nation. And this is a phase, I assure you, where health systems transformation is taking place in the country. This phase will always be a special phase. And therefore, expectations from you truly are that you will be the agents of change through your hard work that leads to informing which way the policy and the programs should refine themselves. Nothing like evidence-driven approach, convincing science-driven approach. That is the paradigm of the day. At times we have to just sit down and build a response through the best knowledge available on the table, sitting down together. But the deeper paradigm for policy development and health systems requirements and health programs to be developed should really be through high quality evidence. I encourage also that the studies that you do, you must publish, because India should be seen as have a strong presence globally, and that can only happen if you publish. To go beyond just a report. I urge you, all NGOs in particular, you write a report and it lies there, you circulate it 20 of us. It's not enough. It should be self-visible. You should be able to put, have the peer groups endorsing it. That's very different from one level shot, which is create a report, share it with some people. It has value. Do not forget the power of behavior change. Do not forget the demand side, and do not forget equity and the true situation in which the health interventions have to reach the people of India. Do not forget affordability. Do not forget a lot that can be done in the home settings by the families and individuals on their own. I wish you the very best. Thank you for this wonderful opportunity. As Abdul said, yes, and Rajiv said that you are the leaders of tomorrow. Research gives you, in public health, research gives you a very special standing, because you then represent, the creators of knowledge, and that has a very high position in the hierarchy of the society and in the system. And therefore, deeper research with an eye on implementation, eye on real change on the ground level will earn you respect and will give you a true satisfaction. Thank you very much.
Thank you, sir, for that very inspiring message, not just for our fellows, but for all of us as well who work in the healthcare sector, and for also placing the fellowship program in the larger context of healthcare improvement in India. And now to conclude the program, I would propose a formal vote of thanks. I would like to call upon Dr. Rajesh Kumar, the technical advisor at HSTP. Again, sir would not require any introduction.
I think all of us have been introduced many times, okay, even during this morning. So once again, good morning to all of you and welcome. On behalf of HSTP, this is my privilege to propose a vote of thanks on this memorable occasion. First and foremost, we would like to thank everyone who joined us here, as well as in virtual space, those who could not join physically. As you know, the COVID pandemic is in some kind of a low phase in India, although we know new variants can strike anytime, anywhere in the world. So we have to be vigilant and on guard. But this moment gives us some space to think about the health of the health system, especially in view of the challenge which we faced in last 2 years. This is my second face-to-face meeting in the 2 years. The first was governing body meeting of NIHFW last year in March. That was also a time when COVID was a bit low. So one thing which we have learned in these last 2 years is that whatever we have done in our health system, there was something positive that when this news came, the country rose to that challenge, and very quickly we set up a surveillance system in the country, and people who needed were tested, treated, and this was the strength at the front line. The architectural change which NHM brought into this ASHAs, additional ANMs, and this Ayushman Bharat, the community health officers, newly recruited community health officers. I was working in Punjab at that time, that how they were the ones in the front line who could suspect infections, get test to them, and try to get them a hospital bed if needed. And eventually, in a very short period of time, we saw how system responded, and people even were able to get tests done just by a phone call. And in some of the areas, you could see that if there was we could find out, in which hospital, how many beds are there, where people can go. So in times of crisis, I think given the political will, we as a nation can stand and face challenges. But I think that kind of spirit we need to continue, in times like this also. And we have a roadmap, as Professor Vinod Paul mentioned, Ayushman Bharat, very comprehensive program. It is going on, but this is for us to see that it is taken to its logical end. So the challenge of universal health care is not, it is not impossible. Some people think it is impossible, but given the strength, given the political will, we can, I think, achieve this with our, innovations and with our grit. I would say nobody had imagined in year 2000 that India can achieve MDG, maternal mortality, neonatal mortality. Nobody believed at that time India can achieve these figures, but India did achieve. NHM has made a considerable impact in our health system, but still we do not have a health system, which we can be, really proud of, but we can build it bit by bit and can reach there in 2030. So I think this kind of vision is in front of us, and we need to build a ecosystem as mentioned by Dr. Maharaj Bhan in his vision, which was mentioned by Dr. Vinod Paul. We need to remember that, and we are really thankful to him and Dr. Vinod Paul. As he mentioned, in Himachal, this thing was conceived. We need to take it forward. Many people have helped us in this journey. We would like to thank Shri Ratan Tata Trust, Bill Melinda Gates Foundation, Access Health International for supporting us in this endeavor. We are grateful to Dr. Abdul Ghaffar, Executive Director, WHO Alliance for HPSR, for extending his support all through and his words of inspiration today. His able guidance will always be remembered for his support, which we always have. This year, we have received a very good response to the fellowship applications, and with that shows that there is a lot of interest in this field. And with the international jury, all those who were selected as a merit on the basis of merit, these 20 fellows, very strict selection criteria. You have made it. Congratulations to you. And we hope that in future, with the support of government of India, if we can extend this to larger number of fellows, if we can expand our network of faculty, I think in a large country like India, we need that kind of a effort. And I'm sure with the support of government, we can do that in coming times. We are fortunate that we have faculty from many institutions who are supporting us. Especially, I would like to name them here: Nosal Institute of Global Health, University of Melbourne, Institute of Tropical Medicine, Antwerp, and Achutamenon Center for Health System Studies, George Institute for Global Health, Institute of Public Health Bangalore, and India Health System Collaborative for contributing faculty to this program. These valuable partnerships, they strengthen the learning ecosystem and provide a platform for the fellows to interact and the experts to also to interact with them, with their professional skills to enrich this course. We look forward to further engagement with the state governments and their technical support and development partners, India and global public health schools, and other collaboratives to strengthen this initiative. We are really grateful to our dignitaries, Shri Vinod Palji, Member Health Niti Aayog, for guiding us in this, and we look forward to your support for taking it further. We are thankful to all my colleagues in HSTP also, and especially Dr. Rajiv Sadanandanji. You have been working so long in health system, so we consider you as an honorary doctor. Yeah, so today also. So for your unstinted support to this program. And once again, I thank all of you for your attention. And I wish that this cohort 2020, all the best. I'm sure you will this program will benefit not only you, but through you, the countrymen will benefit. I'm sure about that. Thank you very much.
Thank you, sir. Thank you. And with that, we formally conclude the program. Thank you. I invite everybody else for tea.